Hi. I'm robo-Suzie and today I'll talk to you about heart disease facts. Also don't forget to subscribe for more tips in the future. But back to our topic. It is estimated that approximately 7% of the population has some form of heart disease or damage to their heart. Most people associate heart disease with arterial sclerosis, which leads to heart attacks. However, there are other forms of heart disease, which are just as deadly. Knowing the facts about arterial sclerosis as well as the other primary forms of heart disease can enable you to recognize the symptoms both in yourself and loved ones. And early recognition is one of the most important factors in surviving heart disease. Arterial sclerosis is the most common type of heart disease. This disease is characterized by a hardening of the arteries, including the coronary arteries, which surround and nourish the heart. Many believe that this process begins early in life. It is so common that it is found present in over half of Americans at death. Though the exact process is unknown, it is understood that the buildup of plaque in blood vessels eventually causes the arteries to harden. Thus, the plaque seems to be the precipitating factor. Luckily, this can be controlled through a proper diet and regularly exercise. Eventually the buildup is enough that the blood flow becomes seriously constricted. When this happens, the result may be a myocardial infarction, which we commonly call a heart attack. Another possible result of this same problem is when the fatty deposits form a clot that eventually cuts off the blood supply to the heart or some other vital part of the body. These two possibilities amount to the most frequent cause of death for the average American. Cardiomyopathy is the next most common form of heart disease. This disease takes the form of impaired function of the heart itself. What has happened is that somehow the heart has been damaged and weakened to such an extent that the pumping action is impaired, and in the process of compensating the muscle grows larger and larger. As the damage increases, the danger of clotting and cardiac arrhythmia increases as well. Cardiomyopathy often results in damage to the heart's electrical system and is the primary factor in later developing arrhythmias. Many patients with cardiomyopathy are the prime candidates for heart transplants, which has a chance of saving their lives. The final form of heart disease is when damage takes place on or near the heart valves themselves. This damage is usually a result of a congenital defect or an infection. Often it is a strep throat infection, which untreated, leads to rheumatic fever and eventually direct damage to the heart valves. Rheumatic fever has been well controlled in the United States, but it is still responsible for approximately 7,000 deaths per year. As far as congenital defects, it is estimated that only a portion of the 25,000 babies born yearly with heart defects have damage to the heart valves. One known cause is when the mother contracts German measles during late-term pregnancy. Regardless of the type of heart problem encountered, it is helpful to know the common warning signs for a heart attack. They are a feeling of pain or slight pressure to the chest or a crushing sensation behind the breastbone. This may radiate to the shoulder, arm or legs. The feeling usually lasts for a length of time. OTC medication or rest does not reduce the pain, though it will respond to a narcotic drug. The face often turns ashen gray and a cold sweat develops. Often this is accompanied by nausea and shortness of breath. Retching, belching or vomiting may occur, which is often confused with indigestion. If you or a loved one experiences these symptoms, get to a doctor. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.